Unfortunately, Shilpa Taneja Mittal, who's been a colleague of ours, as well as a student of mine, a fellow of mine, has not been able to make it because of being unwell. So let's hear her on video and on Zoom, and then let's start off with this. Thank you once again for being here.
Hello everyone. So in next 12 minutes, we are going to learn facial anatomy through cadaveric dissection videos. Why is it important to learn anatomy? Anatomy of any region is the most basic, yet the most important part to know before any procedure for safe and efficacious injections and to achieve consistent results every time. I have divided my presentation into 3 parts. The upper face, the second part describes the mid and lower face, and the third one describes the vasculature of the face. Starting with the first part, the forehead area. As we lift up the skin in a cadaver, the most important structure in this area is the frontalis muscle, which runs from the medial to lateral side and bifurcates in a V-shaped manner, although not in this cadaveric dissection specimen. Here, important part to remember is when we inject neuromuscular injections, they should be 2 centimeters above the brow so that we do not cause brow ptosis after injecting them. The supratrochlear and supraorbital artery anastomose hair in this area and form the most important zone and can be considered as a danger zone because any retrograde flow in these can lead to blindness. In many of the surveys, it has been seen that glabular injections of the filler is the most common cause of blindness in patients. Next, deep to frontalis muscle, here lies the corrugator muscle, which spreads from the bone and attaches itself to the skin. It either can go vertically up or it can go horizontally in this direction. So whenever we want to inject into the corrugator muscle, ask the patient to animate and then inject. Inject deep into the corrugator muscle body and not superficial. The tail of the corrugator, however, when travels to the skin, lies superficially and we can inject superficially into the corrugator muscle there. Centrally, there is procerus muscle here. Pinch the muscle into your hand and inject the neuromuscular injection whenever you want to. Just take care of the retrograde flow here because the danger zone 1, as we saw, lies here. The supraorbital nerves and vessels lie here and run at the center of the forehead right here. Whenever we want to inject the neuromuscular injections or fillers, especially in cases of fillers, the injections should be multiple small bolus with less pressure in to and fro motion so that there is no risk of large boli and retrograde flow into the vessels. This is the fusion zone where the frontalis muscle fuses with the temporoparietal fascia. The next most important zone in the upper face is the temporal area. As we lift the skin, the temporal area is basically defined from the root of the helix to the lateral canthal area, inferiorly up to the fusion area superficially. When we lift the skin, we see the superficial temporoparietal fascia here. And below this superficial temporoparietal fascia lies the deep temporoparietal fascia. The danger zone 2 lies here right in front of the root of the helix. The superficial temporal artery becomes really superficial and lies 1 finger breadth above this brow area, and thus while injecting we should take care of injecting fillers in this area. The frontal branch of the temporal artery anastomoses with supraorbital and supratrochlear vessels here, and retrograde flow here can cause loss of vision. The middle temporal vein, as we can see here, is the most prominent structure here. It drains into jugular vein and emboli can travel retrogradely and can cause danger to life. This is also an important structure to remember here, the middle temporal vein. Inject superficially between skin, this fold, and superficial fascia, that is the superficial temporoparietal fascia, that is the safest zone in the temporal area to inject fillers. Coming on to the second part of the presentation, the midface. The important structure here is the facial nerve. Facial nerve lies deep into the root of the ear lobule here, and it travels up, gives two major branches here, the frontal nerve branch and the superficial temporal nerve branch, which lies above the zygomatic arch. They lie 1 finger breadth above the zygomatic arch here, above the lateral brow, and run in general with superficial temporal artery. So careful injections here again are required. Below the skin, in the midface, all the aesthetic contours are formed by the sustained fullness in the facial fat compartments. The superficial fat compartment, as we can see here, and when we lift these, the deep fat compartment, as we can see the deep fat compartment between the mimetic muscles of the face. The superficial lateral fat compartments are again divided into the temporal, lateral, cheek and neck area compartments. Whenever we want to inject fillers in this area, the malar area, it is important as we inject to take care of these mimetic muscles and inject 1 finger breadth below the inferior orbital rim and inject laterally and not medially, so that we do not first of all accentuate the nasolabial fold, and also the inferior orbital nerves and vessels lie here. So inject laterally and massage the filler medially. The branch of facial vein coming here, as we can see here in the malar area, in the superficial fat layers, so thus inject deep in this area. Coming to the perioral area, which is the next most important area in the midface, deep to the superficial medial fat compartment lie 4 major mimetic muscles around the perioral area. The zygomaticus major, the zygomaticus minor, levator anguli oris, and the deep anguli oris. So injections here, when we inject for cross feet, if by mistake injected into the zygomaticus major muscle, can cause drooping of this angle of the mouth. That's why the crow's feet injections should be really superficial and carefully subdermal. This is the DAO, the deep anguli oris muscle, which lies here. Always whenever we have to inject here, the neuromuscular injections, we should inject laterally in the area of DAO and not in the area of DLI, which is a medial deep muscle which lies below the DAO. Injections into the DLI will cause droop of the lower lip. The important structure here is the masseter muscle again in the midface. Whenever we want to inject botulinum toxin into the masseter muscle for masseter hypertrophy or bruxism, as it is the most powerful muscle in the human body, it lies deep to the buccal fat pad. Ask the patient to clench the teeth and then get hold of the muscle, the lateral and the medial borders. Inject around 1 centimeter deep. As we can see, the needle goes in around 1 centimeter. That's when we can get the proper effect into the masseter muscle. So coming on to the vasculature part of the face, the facial artery starts from the neck. As it goes up, it becomes superficial. It lies 1 thumb breadth lateral to the commissure and takes a tortuous course and goes up and becomes really superficial here near the ala of the nose. Here in the superior lip, it gives a branch, the superior labial artery, which lies at the junction of wet and dry vermilion, deep to the orbicularis oris muscle, and The other branch, inferior labial artery, which lies deep to the DLI. Here, we can see this artery here. This again marks a danger zone as the facial artery really becomes superficial, close to the ala of the nose. Whenever we want to inject fillers here, fan the fillers or inject laterally and then massage them medially. And inject deep. Do not inject superficial in this area because of the facial artery running very superficial near the ala. Again, there is anastomosis, as we all know, near the angular vessels here. Any injections in the medial part of the face should not be in this area, and one should inject around 1 finger breadth below the inferior orbital rim and then massage the filler medially. Nose again is a very vascular structure here. All the vascularity of the nose is in the superficial plane. Whenever we want to inject fillers in the nose, since the facial artery branches into lateral nasal and arborizes with the columnar vessels here, and again near the radix, it anastomoses with the external nasal branch and lies superficially. So the most safe zone to inject fillers is the central third, as shown here. This central 1/3 of the nose is the safest zone and not the lower 1/3 and neither the upper 1/3 to inject fillers. And that too, when you move over this mass, we can see free movement of these structures. This is the zone where we need to inject the fillers. So that completes the vasculature of the face. Thank you for your kind attention, everyone.
Thanks to Shilpa for